Hello everyone, welcome back to my channel Simplified Dentistry. In my previous videos, I have discussed about the structure, functions and classification of oral mucous membrane. And now in this video, let's have a look on the questions related to oral mucous membrane that have been asked in various exams. So the first question is, Lamina densa of the gingival basement membrane is rich in, and the options are option A, type 1 and 3 collagen, option B, type 3 collagen, option C, type 4 collagen, and option D, type 1 collagen. So as I have already discussed in the structure of oral mucous membrane, that lamina densa is the dark zone of basal lamina, and basal lamina is the term usually used with electron microscopy. That is, when viewed under the electron microscope, basement membrane is called basal lamina. And to know in detail about the basement membrane, you can watch the video on the structure of oral mucous membrane. I'll mention its link in the description box. So the lamina densa is rich in type 4 collagen. So the lamina densa of the gingival basement membrane is rich in type 4 collagen. Second question is, cells of the spinous layer are generally, and the options are option A, larger than the basal cells, option B, smaller than the basal cells, option C, same size as that of the basal cells, and option D, none of the above. So the cells of the oral epithelium becomes larger and flatter in size as they move from basal layer to the corneal layer. So the answer is larger than the basal cells. So the cells of the spinous layer are generally larger than the basal cells. Third question is, epithelial cells which ultimately keratinize are known as option A, keratinizing cells, option B, melanocytes, option C, non-keratinizing cells, and option D, clear cells. So the keratinizing cells are the ones which keratinize. So the answer is option A, that is keratinizing cells. So the epithelial cells which ultimately keratinize are known as keratinizing cells. Now the next question is, biomechanism that unites the epithelium to the tooth surface is option A, internal basal lamina, option B, junctional epithelium, option C, reduced enamel epithelium, and option D, epithelial attachment. So the internal basal lamina of the junctional epithelium unites the epithelium to the tooth, whereas the external basal lamina of the junctional epithelium unites the epithelium to the connective tissue of gingiva. So the answer will be A, that is internal basal lamina. So it is the internal basal lamina that unites the epithelium to the tooth surface. Next question is, stratum granulosum is not present in, options are option A, hyperorthokeratosis, option B, hyperparakeratosis, option C, non-keratinized epithelium, and option D, sulcular epithelium. So, as we all know that the non-keratinized epithelium has three layers, and the layers of non-keratinizing epithelium are stratum basale, stratum intermedium, and stratum superficial. So it is the non-keratinized epithelium where the spinous layer and the granular layer are absent. So the answer will be non-keratinized epithelium. So stratum granulosum is not present in non-keratinized epithelium. The next question is, epithelium of oral mucous membrane is, options are option A, keratinized, option B, non-keratinized, option C, ortho, para and non-keratinized, and option D, only parakeratinized. So, the epithelium of the oral mucous membrane is stratified squamous, and it can be either keratinized or non-keratinized. And when keratinized, it can be either orthokeratinized or parakeratinized. So, the answer will be ortho, para and non-keratinized. So the epithelium of the oral mucous membrane is orthokeratinized, parakeratinized or non-keratinized. Next question is masticatory mucosa in the oral cavity covers the, and its options are A. Floor of the mouth and soft palate, B. Alveolar mucosa and vestibular fornix, C. Lip and cheek, and D. Gingiva and hard palate. So the masticatory mucosa is present in the regions which aids in mastication, and it includes gingiva and hard palate. So the answer is option D, gingiva and hard palate. So the masticatory mucosa in the oral cavity covers the gingiva and hard palate. Next question is masticatory mucosa is, and its options are A. Parakeratinized, B. Orthokeratinized, C. Non-keratinized, and D. Subkeratinized. So as we have already discussed that the masticatory mucosa is present in the regions which aids in mastications. So this region is usually keratinized to withstand the forces of mastication, and it is moderately thick and is frequently orthokeratinized. So the answer is option B, orthokeratinized. Masticatory mucosa is orthokeratinized, and it is seen that hard palate is mostly orthokeratinized and gingiva is frequently parakeratinized. Next question is non-keratinized epithelium is found over option A, attached gingiva, option B, free gingiva, option C, interdental papilla, and option D, gingival sulcus. Here all the options are related to gingiva, and we have already discussed earlier that the masticatory mucosa, which means the gingiva and hard palate, is keratinized and gingiva is frequently parakeratinized. But gingiva is non-keratinized in 10% of the population, and the non-keratinized areas in gingiva are sulcular epithelium, junctional epithelium, and interdental cone. So according to the given options, option D is the answer. So non-keratinized epithelium is found over gingival sulcus, that is sulcular epithelium, as the gingival sulcus is lined by the oral sulcular epithelium. Now the next question is the connective tissue of the gingiva is known as, options are A. Lamina dura, B. Dental cuticle, C. Lamina propria, and D. Fibroblast. So histologically, oral mucous membrane comprises of epithelium and connective tissue, and the connective tissue is known as lamina propria. So the answer is option C, lamina propria. So the connective tissue of the gingiva is known as lamina propria. Now the next question is difference between the skin and mucosa of cheek is, option A, thin lamina and non-keratinized mucosa of cheek, option B, keratinized mucosa of cheek, option C, retipex, and option D, thick lamina propria on skin of cheek. So the mucosa of cheek is non-keratinized as it is the lining mucosa, and the non-keratinized epithelium lacks the granular layer and the spinous layer and is known to be generally thinner. So it is actually thinner than the keratinized epithelium. So the answer will be option A, that is thin lamina and non-keratinized mucosa of cheek. Next question is keratohyaline granules are found in, option A, stratum granulosum, option B, stratum spinosum, option C, stratum basal, and option D, prickle cell layer. So the keratohyaline granules are found in the stratum granulosum layer. So the answer will be option A, that is stratum granulosum. Next question is also related to keratohyaline granules. The question is keratohyaline granules are more evident in, options are A. Keratinized, B. Non-keratinized, C. Parakeratinized, and D. Orthokeratinized. So as we have discussed earlier that the keratohyaline granules are present in the stratum granulosum, which is present in the keratinized epithelium, and is absent in non-keratinized. And the keratinized epithelium can be either orthokeratinized or parakeratinized. In parakeratinized epithelium, the stratum granulosum cannot be appreciated clearly. So, the answer will be option D, that is orthokeratinized epithelium, which has the prominent granular cell layer, that is, it has prominent stratum granulosum. So, the answer is option D, orthokeratinized. Keratohyaline granules are more evident in orthokeratinized epithelium. Next question is, protein making up the bulk of keratohyaline granules in stratum granulosum of keratinized epithelium is option A, involucrin, option B, vinculin, option C, filaggrin, and option D, nectin. So filaggrin is the protein which makes the bulk of keratohyaline granules. So the answer is option C, that is filaggrin. So the protein making up the bulk of keratohyaline granules in stratum granulosum of keratinized epithelium is filaggrin. Sulfur-rich protein lauricin is also present. So filaggrin and lauricin are useful markers of epithelial differentiation. You can also keep in mind that involucrin contributes to the conified cell envelope in the cell membrane of keratohyaline cells. Next question is, bulk of lamina propria of the gingiva is made of collagen type. Option A, type 1, option B, type 2, option C, type 3, and option D, type 4. This is the list of all the major contents of lamina propria, and it shows that lamina propria contains type 1 and type 3 collagen fibers, and the normal gingival tissue contains type 1 and type 3 collagen in the ratio of 5:1. So this means that type 1 is more as compared to type 3. So the answer is option A, that is type 1. So the bulk of lamina propria of the gingiva is made of collagen type 1. Next question is, stratum germinatum is option A, stratum basal, option B, stratum granulosum, option C, stratum basal and parabasal spinous cells, and option D, stratum spinosum. So sometimes some of the spinous cells above the basal cell layer also shows the presence of mitotic figure, and this combination of basal and parabasal spinous cells, that is the spinous cell beside the basal cells containing the mitotic figures, is called as stratum germinatum. So the answer is option C, that is stratum germinatum is stratum basal and parabasal spinous cells. Next question is also related to stratum germinativum. So the stratum germinativum of the oral epithelium is the term given to basal cells and parabasal cells. Next question is, which of the following is correct? And the options are option A, non-keratinized epithelium is characterized by the absence of stratum granulosum and stratum corneum, and the surface cells are nucleated. Option B is parakeratinized epithelium is characterized by superficial cells with pycnotic nuclei and absence of stratum granulosum. Option C is in orthokeratinization the superficial cells lose their nuclei but stratum granulosum is present. And option D is all of the above. Now let's check the first option, that whether it is correct or not. So the first option states that non-keratinized epithelium is characterized by the absence of stratum granulosum and stratum corneum, and the surface cells are nucleated. So this is absolutely correct, as in non-keratinized epithelium there is no granular layer and spinous layer, and the cells of the superficial layer is nucleated, which means that the surface cells are nucleated. Second option is parakeratinized epithelium is characterized by superficial cells with pycnotic nuclei and absence of stratum granulosum. So this is also correct, as in parakeratinized epithelium superficial cells are made up of flattened cells that contain few pycnotic nuclei, and the granular cell layer cannot be appreciated clearly in light microscopy. So this means there is absence of stratum granulosum. Third option is in orthokeratinization, the superficial cells lose their nuclei but stratum granulosum is present. And this is also absolutely correct, as the superficial cells in orthokeratinized epithelium are the flattened cells that contain no nuclei, and it has prominent granular cell layer, that is prominent stratum granulosum. So the correct answer for this question will be option D, which is all of the above, as all the options are correct. Next question is buccal mucosa is option A keratinized, option B non-keratinized, option C parakeratinized, and option D orthokeratinized. So as the buccal mucosa is a lining mucosa, it is non-keratinized. So the answer is option B non-keratinized. So buccal mucosa is non-keratinized. Next question is basement membrane. Option A contains lamina lucida and lamina dura. Option B consists Keratohyaline granules. Option C consists of lamina densa and lamina lucida. And option D consists of desmosomes and hemidesmosomes. Option A is wrong, as it is the basal lamina that contains lamina lucida and lamina densa, and here lamina dura is mentioned. Option B is also wrong, as it should be keratohyaline granules, and that is also present in stratum granulosum and not in the basement membrane. Option C is also wrong. Option D is correct, as the basal cells of oral epithelium are heavily packed with tonofilaments, which are adaptations for attachment. They contain hemidesmosomes and desmosomes. So the hemidesmosomes attach epithelium to the connective tissue, whereas the desmosomes connect the adjacent basal cells. That is, it connects one basal cells to the other. So the answer is option D, consists of desmosomes and hemidesmosomes. So the basement membrane consists of desmosomes and hemidesmosomes. Next question is also same, that the oral epithelium is attached to enamel via option A reticular fibers, option B collagen fibers, option C hemidesmosomes, and option D desmosomes. So the answer will be option C, hemidesmosomes. Oral epithelium is attached to the enamel via hemidesmosomes. Next question is long connective tissue papilla and keratinized epithelia are a feature of these parts of oral mucosa. Option A gingiva and alveolar mucosa, option B hard palate and gingiva, option C buccal and alveolar mucosa, and option D hard palate and soft palate. So the long connective tissue papilla are characteristic of gingiva. This helps in histologic differentiation of gingiva from the alveolar mucosa. Answer will be either A or B, as both the options contain gingiva. But in alveolar mucosa, the papilla are quite low and it is non-keratinized. So this will not be the answer, as the question states the presence of keratinized epithelium and long connective tissue papilla. So among the options hard palate and gingiva, that is option B is appropriate. So the long connective tissue papillae and keratinized epithelia are a feature of hard palate and gingiva. Next question is least pain sensitivity in oral cavity is in which mucosa? Option A gingiva, option B buccal mucosa, option C labial mucosa, and option D dorsal mucosa of tongue. Here is the list of pain sensitivity in oral cavity according to its severity, and it is least in the buccal mucosa. So the answer is option B. So least pain sensitivity in oral cavity is in the buccal mucosa. Next question is the intermediate filaments of epithelium are option A glial filaments, option B desmin, option C vimentin, and option D cytokeratin. So it is the cytokeratins which form the cytoskeleton of all epithelial cells along with microfilaments and microfibrils. They are termed as intermediate filaments as their diameter, that is 7 to 11 nanometer, is intermediate between the large microtubules and smaller microfilaments. So the answer is option D, cytokeratin. The intermediate filaments of epithelium are cytokeratin. Thank you for watching the video. Hope you liked the video, and if you want more such contents then please subscribe to the channel Simplified Dentistry.